Well, hello, and thanks so much for joining me today for episode 9 of season 2 of the Healthy Skeptic MD podcast. I'm Dr. Michael Hochman. So far this season, we've covered a number of common health topics, most recently breast cancer screening, the pros and cons of a daily glass of wine. Next week, we're going to hear from a Stanford cardiologist about what to do if you have a blocked coronary artery to the heart. But this week, we're going to take a break from that focus, and we're going to hear from a school leader who has successfully and safely kept her school open throughout this academic year. That school leader is Dalia Hochman, my first cousin, who is the head of school at the Gan Academy in Massachusetts. And we're going to hear from Dalia about her school's protocols and policies during COVID, and also some inspiring words about how some other school leaders may consider taking the plunge and getting their schools reopened. If you find today's discussion engaging, please do share it with friends, family, and colleagues. Consider leaving a review if you have a chance, and make sure to search and subscribe wherever it is you listen to podcasts or on my YouTube channel. Okay, so before we jump into our interview today with Dalia, there are two health news items I first want to touch on. The first is the overall trajectory of the pandemic. The good news is we've seen a nice steady decline in daily case rates from a peak of about 300 per thousand per day in January and December, down to about 70,000 cases per day now. The problem is we're peaking out, or plateauing out, I should say, at that 70,000 per day mark, and that's still a very high number. We're also seeing 1,500 to 2,000 deaths per day, which is a high number. The optimists out there think we're on the right track. If we just keep distributing the vaccine, with weather improving in the United States, we're heading into the spring, cases are going to continue to decline, and we should just keep moving ahead with reopening schools, the economy, and getting people back to doing the things that they do. The pessimists out there highlight that there are variants percolating out there. There's a lot of vaccine hesitancy, and we're actually not that far if there were to be another surge from getting back to that 300,000 per day mark that we had before. Now, I tend to be on the optimistic side here, but the truth is no one knows. And I think what's important is that we are pragmatic. I think it would be silly at this point to let up on the simple but effective measures like masks and social distancing. However, I do think we need to continue to forge ahead with getting our world reopened. As our guest will talk about today, there's just so much benefit, psychological, mental health, and even physical health to all of us if we can get back to doing the things that we all like to do, our day-to-day activities. So I think what we need to do is we need to move ahead, hope for the best, but we absolutely need to be prepared for anything, because certainly anything could happen. And we have to be prepared that if we do see another one of those upticks, that we're going to have to backtrack again. So the second news item I want to touch on is a new study published this week in JAMA Internal Medicine that looked at the overly aggressive treatment of diabetes. So the analysis involved nursing home residents, and it found that more than half actually have blood glucose levels that are below what's recommended by standard guidelines and what is necessary. And this can, not surprisingly, be quite harmful. It can be associated with increased mortality, and if blood glucose levels drop too low, it can lead to fainting and certainly weakness. So the question is, why would nursing home residents have lower blood glucose levels than is necessary? And probably, I think what's going on is that the same medications get continued month after month without anybody really checking all that closely. And as patients get older, their kidney function changes and the medication levels rise in the blood. And the next thing you know, the patient is on more medications at higher doses than they really need. So this really highlights why it's so important to be an engaged family member. If you have a family member in a nursing home, every so often it is so important to go through that medication list with the doctor and ask, are all these medications for diabetes, high blood pressure, cholesterol, etc., are they all necessary, or could we even consider stopping one of these medications? So that's it for the news summary. Let's jump into our discussion with Dalia Hochman from the Gan Academy. Well, I'm very happy today to have my first cousin join us today, Dalia Hochman, who is the head of school at Gan Academy in Massachusetts. Welcome to the show, Dalia.
Thanks, cousin. It's great to be here.
Well, we have a lot to talk about because you've been able to keep your school open during this pandemic. It's really been impressive as I've heard about it. But first, can you begin by telling me a little bit about the Gan Academy?
Sure, I'm happy to. And thanks again for waking up so early for me. It's later in the morning here in Boston. Gan Academy is an independent Jewish high school that serves the entire Boston area. We teach roughly 300 students in grades 9 through 12. And it was started about 20 years ago by the Jewish community of Boston as an experiment to see what would happen if we could bring students and families from very different religious denominations in Judaism into one community. So we have students from very traditional, observant backgrounds here, as well as very secular students. And the theory of action at our school is that we teach students how to dialogue across their differences with the goal of once they leave our doors, they'll be able to take those skills into the wider world.
Great. And you've been the head of school since when?
This is my second year at Gann Academy.
Well, so take us back to the summer of 2020. We were right in the middle of the pandemic, as we still are now, and schools were deciding whether or not it makes sense to reopen or not. What factors did you think about? Did you consider when deciding whether or not to reopen your doors for in-person learning?
So last summer, I would say across the board for anyone who works in education was very hard. We were struggling with very little guidance from state governments, from the federal government. And we were forced to make really brutal, tough decisions in a short amount of time. In education as a leader, we try to have all of our stakeholders aligned. And what happened last summer is that we found ourselves having to make difficult decisions that essentially pitted our stakeholders against one another. And I think that was the hardest part about the COVID decision making. So, when we looked at our choices here in Boston, we're a small independent high school. And I just should say up front, having worked for nearly 20 years in public systems in LA and New York and DC, I'm now in the independent school space. And, we were in the 0.001% that were able to pull this off. We have so much privilege here in this small high school because we already started with small class sizes and we have a relatively new building. We have a huge amount of outdoor space, and we have a campus that's conducive to cohorting. So when we thought about our options, we said, you know what, let's just give it a try. Let's try to reopen fully for all of our students full time. It may not work. And, we had some teachers betting on how many weeks we would last. But we thought, well, let's just try because we do have all of this privilege. And I want to acknowledge up front that not every school had these factors to play with. So we ended up starting, and I think we were one of the first, if not the first high school in Massachusetts to open in mid-August full time. And we've been continuously in person ever since. We're really proud. We've had no interruptions. Our students are with us 4 full days. And then because we're a Jewish school, we already have a half day on Friday. So we use Friday as a virtual day to do community gatherings and advisory work. And then we have our students meet with teachers via Zoom on Fridays.
Thank you for highlighting some of the advantages you've had, but I think you guys also deserve some credit because you also have some disadvantages being in Massachusetts. It's cold. It's not as easy to use outdoor space. So we'll certainly come back to that. So I certainly think you deserve credit, even if you did have some advantages. And your point about pitting stakeholders against each other, I think that's one of the really tragic things about this whole pandemic. There's good people with perspectives on different sides who are all well-meaning, and this is a setup for pitting people against each other for having different perspectives. But you guys were able to persevere and figure out a way to get things open. So tell us a little. You started to tell me a little bit about the schedule this past fall. Was it a hybrid model? Were you in person every day? What was it like?
So we're still doing it. Our goal is to finish out the school year with this model, and we're really proud of it. The thing about high schools in particular with COVID is that it's very hard to cohort. In a typical high school, you don't have the same group of students traveling from a certain level of a math class to a certain foreign language level. There's so much mixing of students. So that's why you'll see in American education how much harder it is for middle schools and high schools to open. I would argue that the social, emotional, and mental health risks of keeping teenagers and preteens home is just profound. And so we were committed to bringing back kids in some way. What we ended up doing is cohorting by grade. So we have 4 zones in our school, and we had to open up 4 different doors, 4 entrances, and created essentially 4 separate areas of the school for each grade. And this required teachers to have to recreate a lot of classes. It was a lot of work because, for example, a Spanish 5 class might have a few students from every grade in our school. And so teachers had to do a lot of reworking of the curriculum to make this work. So students come in now every day. They do a medical attestation in the morning with their parents do it. Everyone's masked, social distanced, and they go in through their zone and they have a modified course load 4 days a week from roughly 8:30 in the morning until about 3 o'clock. In the fall, we were able to run some after school sports, no contact sports. And in the spring, we hope to do so. But the winters in Boston are brutal. So we're sending everyone home right now at 3 o'clock.
Have you ever had to turn someone away at the door if they screen positive?
We've had a few situations, and I think the key for opening schools is to enable school leaders like myself to have a tremendous amount of autonomy and decision making. We're making really difficult decisions that are part administrative decision making, part educational philosophy, part medical, and part just gut. So we have to be trusted to make decisions. I do have a medical advisory committee that I formed with local physicians. I have an infectious disease doctor from Massachusetts General Hospital and the head of biocontainment at Boston Children's Hospital on my committee. And so when there's a situation, I immediately reach out to my committee. In addition, we have a fabulous school nurse, and this is not a typical year for school nurses. So I give her a huge amount of credit. She does a lot of work this year.
Yeah, I would think this is a big year for school nurses, so hats off to them for being on the front lines for in-person education. You mentioned that the students wear masks. High school students, thinking about mask compliance, are they pretty good about it? And how do you handle, a situation if someone does not abide by that rule?
I think especially for middle school and high school, the naysayers all summer said to me, you'll never keep it safe. You have teenagers. All they want to do is hang out on the weekends. This will never work. And so our team thought about it. And we thought, for high school kids, the best way to do this is to really have them own this. So at the beginning of the year, we brought the student council together and the student leadership together. And we said, look, we're going to come up with what we call a social contract that you're going to help us write. And, it's a very Jewish concept to have a social contract. We call it in Hebrew a brit. And we had the students write a social contract dictating their behavior. And then we had the students present it to fellow students. And I'm a true believer for high schools that student leadership is the key. Because once you have the students buy in, then it's just much more effective. And we said to our students, all of you are begging to come back to school. Our students across the board, over 95% of our students, according to our surveys, want to be in school in person. And so we said, listen, we know you want to see your friends. We know you want to get out of your bedrooms, literally, because last spring they were Zooming into class from their beds. To do this, you're going to have to help us. So they wrote this contract and they presented it through Zoom. And they did it in a really thoughtful way where they asked some of their favorite teachers who have, higher safety considerations and health considerations to tell their personal stories. And we tried to foster the contract being about high school students respecting their elders and what it would mean to do something on a Sunday that would potentially jeopardize the beloved adults in the building on a Monday. And that's how we framed it. And I have to say, and I know that, we're a sort of small boutique school, our kids have taken it extremely seriously. They know the stakes. They get it. And parents tell me that the teenagers in our community and among our families are stricter than the parents. And they'll be out on the weekend and they'll say to their parents, Mom, Dad, we can't do that. It's not in the contract. So I'm really happy to report we've done testing now twice. We had 0 positive in our surveillance testing. We had 0 positive kids.
How often do you do the surveillance tests?
So I have I could tell you, Michael, I have hours and hours of theories about testing in schools. That will be podcast number 2. The truth is, and I'm pretty dogmatic about this, testing only works if it's done for every member of the community every 48 hours. It really doesn't help augment the safety unless it's done in that way. Now, one thing I've learned as a school leader in COVID is that everyone's focusing on infectious disease control and keeping folks safe from the virus. But I think what we've seen, especially in education, is that we're also trying to treat anxiety. And that's real and that's legitimate. And it's okay to say, this act right here is not actually going to help us prevent transmission of this virus. testing once in a while will not keep anyone safe in a school. For sure, we know that. The second that I test my community, that they can go out and get COVID. However, once in a while, like coming back from winter break, we did it because we thought, this will treat the anxiety. In January, the rates in Massachusetts were extremely high, just as we were coming back from winter break. And so I decided for the school to do a round of surveillance testing to treat anxiety. Again, it's not treating COVID, it's treating anxiety, but I think that's okay.
So to be clear, you were not doing the testing every 2 days. It was just a couple times.
It's completely unaffordable for schools to do that. It's completely impractical and unaffordable right now. Until anyone in any sort of government position is able to enable that, I would encourage school leaders and district superintendents to not even go into testing, because the only thing that keeps us safe is every 48 hours, the whole community. Sample testing, pool testing is a nice idea. It just doesn't work.
I think it's such an important point, and I've made this point in this podcast before. If you look at the models, unless you're testing everybody virtually every day, as you said, the impact on the rate of spread of the virus is so small. So if you even do just once a week testing of everybody, you get about a 10% reduction in spread rates. Not to say that's nothing, but it's just so modest, and compared to the financial investment in that, resources could be spent in so many better ways. So I sounds like we're completely on the same page on that.
Well, I'm just going to add, Michael, I think, so much of reopening schools is a mixture between science, public health, and just educational best practice, because it becomes a little dangerous to overly rely on my medical advisory board. I also have to use my best judgment about what will make the school actually work. So in other words, I found with testing, the amount of paperwork and organizational stress and questions essentially paralyzed the school. We couldn't even learn. So what's the point anyway? So I have to weigh a lot of factors. And for me, if something is not actually going to improve the health and safety of my community, it feels okay, but at least we should name it's not going to improve the health and safety of the community.
Yep, I think that's a very well said. And speaking of that, what the science says and what makes people feel comfortable. We were talking a little bit before we started recording here about cleaning, surface cleaning, and we know more and more from the science that coronavirus does not spread that effectively from surface touching. It's mainly through the respiratory droplets, but yet we still clean surfaces and do those sorts of things. It tell us a little bit about the cleaning protocols and your motivation for doing that.
So again, this past summer when we were planning the reopening, we threw every spaghetti against the wall, every idea. So we thought we needed, we did upgrade our ventilation, and we brought in portable HVAC, air ventilation purifiers. We created a whole schedule where in between classes, we asked student leaders to spray down the desks, and then we air them out for 10 minutes. We keep windows open all year, which in Boston is actually very hard to do because we have really cold weather here. So we tried everything. We found as the year went on, we read the science, and we became, and this is where I really relied on my medical advisory board. The data on surface to surface transmission over the past few months has increasingly shown that that's not really how this virus, the biggest threat for in-person schools. So we still do it. And again, I think it really helps in terms of anxiety and the behavior and the feeling of safety, which again, I don't want to minimize in school reopening. And so just knowing, if you're teaching a math class, and just knowing that entire class is going to be sprayed down, and there's going to be a 10-minute window open break before the next group of kids come in, really helps teachers and kids feel safe. And if that's okay, but I just want to be clear, it really hasn't shown to be a cause of transmission. I will say, and we haven't yet really dug deep into masks, the one thing that I have been extremely strict on, and my students know this, is mask wearing. And so in Boston, we have a lot of schools that are open, hybrid or full-time here. And, a lot of, in Boston, in Massachusetts, it's very hard to go outside every day of the year. So when we made the plan for this year, we said, you know what, let's keep it simple. When you're inside the building, you keep your mask on. And the only time you take your mask off is when you go outside. So we created a schedule where there are mask breaks in between classes where kids go outside and they have to sit 6 feet apart on sort of pieces of tape that we put on the ground. And they get a mask break and they have to go outside to eat lunch. And as you can imagine, this worked beautifully in the August, September, October, even November in Massachusetts. But the past few months, it's been really hard. And kids are still going outside. We had one day a few weeks ago, it was 22 degrees Fahrenheit. There was sort of ice, snow falling. It was frigid. And, kids were saying, I can't eat, my fingers are cold. But for the simplicity and elegance and sort of just organizational and administrative reasons, it's been really easy and good and clean to say we never take our masks off inside. And having lived and worked in Los Angeles, I keep on thinking, man, they're so lucky out there. They could do this every single day of the year. You guys could actually run schools entirely outside in Los Angeles, unlike in New England. And frankly, everyone enjoys it. So I would recommend, as Los Angeles is thinking about opening up its schools, to really think about all the outdoor spaces as classrooms, because it's much, much easier to have mask breaks and lunchtime and all the things that you need to do when you're teaching kids outside. So for us, the outside, and I would challenge all of you in California, we could do it up here with really cold temperatures. You guys can do this. You just have to really, really be thoughtful, and it takes a huge amount of work.
Yeah, well, ironically, of course, California's been on the more conservative side of reopening schools, and yet, as you said, that's a real advantage we have, is that the outdoors, it's much more reasonable to be year-round and eat outdoors. So, to hear you guys eating outside or going outside during 21-degree days, I guess we gotta toughen up here a little bit out in
California. I say to my students when they come in, 16-year-olds like to complain about the cold, even in Massachusetts, and I say, listen, there's no bad weather, there's only bad gear. And I would say, I really think that keeping masks on inside is a good policy, especially for older kids, because then there's no slippery slope.
Right. And masks, you talked about surface cleaning, surface spread being a less of a factor, but certainly those respiratory droplets, and we have pretty good evidence that the masks do make a big difference. So that is something to be strict on, as you said. I want to talk a little more about the ventilation. You mentioned an HVAC system. Did you purchase a new system, and are those expensive?
So, I think that the costs of this are just profound. And, as an independent school last year, because of COVID and economic hardship in Massachusetts, we gave out an extra $1 million of financial aid to make sure that our students could still afford our school. And then on top of that, we had to pay for these HVAC improvements and these portable air filtrations. So ultimately, there are additional costs. We also hired college students to help us proctor some of the smaller classes, because when you only have 10 or 11 kids in a class, you need more adults. There are tremendous costs involved in this, but so two things I would say, knowing the politics of education in California in particular, I think governments have to step up and provide costs, but I also think that building level leaders, principals, and those really connected to the schools need to make decisions about costs, because every building is different, every setup is different. In some classrooms, you can open windows and you get the same effect. So it's really, I think with COVID and school reopening, it's really dangerous to make blanket statements like, millions of dollars on HVAC. Well, maybe in some cases, and only if you have to be inside. So I would encourage all of those thinking about school reopening to really lean on local leadership and school level leadership to make these decisions.
Yeah, I think Windows is such a high value intervention. In hospitals, the rate of tuberculosis spreading in hospitals is actually much lower in many developing countries compared to the U.S. And the reason for that is they just keep the windows open. There may be certain circumstances where you do need to upgrade an HVAC system, get air purifiers, but in other cases, it may be as simple as opening a window. Do you think that the HVAC investment that your school made was worthwhile in retrospect, or is it hard to say?
I think, again, last summer, we really didn't know and didn't understand. So, and again, we were treating significant levels of anxiety among our teaching force and our parents and our kids. So anything we thought would help, we did it. But I think now we have a little more time, we have a little more data. So again, I would be really cautious about saying for every school we're spending thousands of dollars on HVAC. I think it really has to be done school by school, which is why it's harder in big systems. I completely appreciate why it's much harder in bigger systems to do that.
So you have been back at school since the fall. Have you had any students or staff or teachers who have tested positive?
We have had a few students and a few employees. We've been under the rates of transmission in Massachusetts consistently. When we have had a few cases, all of them have been as a result of household gatherings for holidays or socializing, and that reflects the national data where the highest risk is to gather without a mask in another person's house. None of the cases have been about school-to-school transmission. In fact, we had one case, so we've only had very few. And so we had one case in our 11th grade cohort, and it was sort of our test case to see if all of these policies I've just been bragging about were working. And so what we've done is we've done an incredibly conservative approach to quarantine. So we have roughly 86 or so 11th graders, another 10, 15 teachers who teach 11th grade. So we cohort the teachers by the grade. So they're assigned to a grade. And so what we do is we send everyone home for 10 days, the whole entire 11th grade and all the teachers who taught in 11th grade.
So anytime there's a positive, everybody goes home.
Everyone in the cohort. And in the elementary schools here in Massachusetts, the cohorts are much smaller. So my kids go to in-person school here, and they're in 5th grade, 3rd grade, and 1st grade, and their cohorts are one teacher with 12 kids, 12 elementary kids. So for elementary schools, it's no big deal. You're only taking out 12 or 13 people out of hundreds of people. And that's why cohorting is critical for reopening schools. You've got to think about the cohort. High schools, as I mentioned, is incredibly hard to do because a high school schedule does not involve the same group of children, young adults, teenagers, adolescents traveling together. So we just couldn't do it. So we had to have this big cohort. However, the other high schools in Massachusetts, the public high schools, are much less conservative, and they do contact tracing by CDC guidelines, and they only ask those who've been exposed as per CDC guidelines to stay home. But we've been incredibly conservative, and I've been criticized by parents, primarily parents, saying, why are you sending 100 people home with one positive case? My kid hasn't ever been in the same class as this kid. And again, it's not the medical basis that I'm making these decisions. I'm making these decisions based on thinking about the most anxious parent or the most anxious teacher, or frankly, the most anxious 16-year-olds, because our kids are really nervous about getting COVID. And so in thinking about being extremely conservative in our quarantine policy, I'm trying to also treat the anxiety as well as the disease. So we had one test case a few weeks ago with one student who tested positive and, was a close contact for at least 20 to 30 other students, and not a single one was positive. And they were around with masks, distance, with the eating outside, and that showed us that these policies work. We're not transmitting this virus in schools. Now, there could be asymptomatic spread that we don't know about for sure. But for the most part, as per the national data, schools are not the places, if done well, where this virus is being spread.
Yeah, and that's also what we've seen in healthcare settings where everyone's wearing masks and following these protocols. There's just such a small amount of spread. It's really in these family gatherings, as you said. So Dalia, we talked about the students and how important they were in developing the social contract and their enthusiasm for getting back in the classrooms. What about the teachers? How have the teachers responded to being back in person learning?
So I need to say every school leader is really a teacher of teachers. So if I can't have my teachers feeling comfortable about teaching, there's no school. And I think that's something parents don't fully understand is you don't want a teacher with your child all day who's not bought into this and feeling comfortable and safe. And so I worked a lot with my teachers last summer, and it was hard. There were some who said, I trust this. I'm going to give it a try. Let's see. There were some who said, this is really scary and I don't feel comfortable. And, I think it's a process. And I think with COVID, every adult's life situation is really different. We have some teachers who are primary caregivers of elderly parents. We have some teachers who teach at our independent high school, but their kids go to a public school where they have remote learning for their own children. And, that's a hard dynamic to ask a teacher to come in and provide for their students, but no one is providing for their own children. So there's all sorts of interesting, difficult dynamics with teachers on this. And I think as a school leader, you have to listen and respond and be empathetic and not generalize and not fully try to understand everyone's home situation. I can tell you that among the group who were the most, uncomfortable and uncertain about coming back, several of them have come to me over the course of the year and said, I was really a skeptic. I really didn't think this was going to work. And I was really nervous. And I felt like you were asking me to really sacrifice more my safety for this. And I still feel nervous. It's not going to go away. But there's been a therapeutic benefit for me as a teacher to coming back in person. I have a community. I have people to talk to. I don't feel isolated. The reasons I love teaching, which is the connections between the students and the teachers, I'm able to really glean more than on Zoom. And I think a lot of teachers in my school right now would say, and you have to ask them, I don't want to speak on their behalf, that it's hard. It's much harder teaching in a mask than teaching without a mask. Our teachers sometimes are eating lunch in their cars in the cold weather in Boston. It's really hard and it's not ideal and it's exhausting. It's exhausting physically. It's also exhausting emotionally to constantly be in a little bit more of a heightened state. But I think ultimately having a community, feeling like we're pulling together, having colleagues to lean on, it's been really actually helpful for the adults in my building. And I feel like our story of this pandemic will be a little different because we've had a different experience. We've been in person, we've been going to work every day, we've been showering, getting up, getting dressed, going somewhere. I think we're doing pretty well. And again, we have all sorts of privileges that teachers don't have. But I do think ultimately we're never going to erase the risk, right? It's never a zero risk proposition. It's all about mitigating the risk. And ultimately, I think the risks right now of mental health, mental illness and mental health considerations, isolation, loneliness among children and adults, frankly, are really high. And so getting people back into a community and institutions is important.
Well, you began our discussion by talking about how this pandemic has pitted groups against each other. And certainly here in Los Angeles, there's been a sentiment that the teachers have been obstructing returning to school and so forth. And, it's really too bad because I think, as you said, the teachers, I think the vast majority of them, there's always a couple bad apples, but the vast majority of them really want to be helping students and they're anxious for understandable reasons. But it's I think very helpful to hear that all the emotional, psychological benefits, the professional satisfaction that your team has gotten from being able to be in person. And that actually picks up on the next thing I wanted to ask. You've, before working at Gan Academy, you worked for the LA Unified School District in Los Angeles. You worked in Washington. You were a teacher in the New York public schools. And many of these other schools have not been, I guess, as aggressive about getting back to in-person learning. Certainly my kids here in Los Angeles haven't had a single day of in-person instruction since March. Your setting is very different. You have certain advantages that we don't have here in some of these big public school districts. On the other hand, we do have nicer weather here, and that is a big advantage. What perspective could you add about the LA Unified School Districts and other big districts about whether or not they're able to get back?
I think it's so complex, Michael. I mean, again, I do think the weather and the opportunity to use outside as a classroom. I mean, you guys could be outside full time. You don't ever have to go inside, maybe just for potty breaks. But the flexibility around the schedule, the flexibility around the curriculum, all of that, I think over time, especially sort of in this era of standards and testing, it's very hard, right? So if I'm a teacher in Los Angeles, I'm thinking, okay, I could do this outside, but am I still going to be held accountable in the same way for these sorts of very demanding standards and testing. And, it seems to me, in terms of Maslow's hierarchy of needs, the first step for our kids right now is socialization, social emotional supports, the connections with adults, school lunches. I think, so many kids rely on schools for health and wellness. And so I think it takes two to tango, right? When people say teachers are being obstructionists, I always ask, well, how's their management, right? Because obstructionist teachers come from rigid managers. And I think I would put the onus on the managers. I think as leaders, we have more responsibilities to make sure that we do our work, to set clear expectations, to prioritize. A teacher can't do everything well all at once. And so even if LAUSD said, you know what, this next year is about social emotional supports, wellness, health, socialization. I mean, I think kids have regressed socially, frankly, and emotionally. And so even if LAUSD said this coming year, we're going to relax a little bit some of our academic standards and testing just for that, I think it would make teachers feel like unleash some of the burdens that teachers feel about doing everything so well. And then, just sort of allowing those building level leaders to be able to work with their teachers. Los Angeles Unified School District is a beautiful, beautiful district. I mean, the number of sort of micro communities in that huge sprawling district, each with their own set of norms, allow the local communities, local principals to work with parents together. I think when things come from the central office, it's very hard to translate. So I would encourage all of these big systems to lean on their building level leaders, and to put the right people in those jobs who can make good decisions and allow them to make decisions for their communities. But I think you guys can do it. I mean, I think, man, it's really hard. It's like double or triple the work. I feel like I'm doing two jobs. I'm a school leader and I'm a public health administrator, two full jobs. But it's so worth it. When I hear the kids squealing with their friends and doing normal things, I mean, they're masked and they look a little different, but they're still doing normal school things. It's really, really important. So I would encourage you guys to go for it. You can do it. There's lots of us who are here to help. And I think parents have to understand the complexity and also be realistic about expectations.
Well, I think you hit on something important with the centralization, and that at the local level, these schools, really the teachers are excited about seeing their communities again and getting back in the classroom. But it is such a large and administratively complex district here in Los Angeles. And there certainly have been back and forth mixed messages. We need to test students every day, all the time to, we don't need testing. We need to wait till everyone's been vaccinated to know that's not necessary. And so we definitely have not gotten consistent messaging. It's a very complex situation. Well, I have one final question for you, Dalia. A lot of parents are living in areas where schools are not reopened, and they may be frustrated. So what advice would you have to parents whose kids have not been back yet at school?
So I think parents, I understand the frustration, and I do think parents should, like you said, engage in dialogue with local educational communities, because I think, it's very powerful to have a local group of teachers and parents, a mixed group, come forward. As long as these decisions are seen as binary, I don't think we're going to get anywhere. But if parents and teachers together form a task force, and work out a plan, and parents have to be willing to roll up their sleeves too, right? Maybe parents volunteer and run lunch duty to give teachers a break from masks, or maybe parents volunteer to proctor some of these classes to reduce the class size. I think parents have to show some skin in the game, and not be, sort of be perceived as anti-teacher. And I think you guys can get there. I really do. And I think it's important. I mean, I think this is like the most important challenge for our country right now. And I can tell you, I'm really concerned about the emotional well-being of the children and the teenagers. And I think we can come together around this. I really do. Teachers really care about the kids.
Well, this was great, Dalia, here. Very inspiring and encouraging hearing what you've been able to do. Congratulations in successfully keeping your schools open. I'm just going to summarize a couple of the take-home messages because I think they're so important. The first thing I took away is how important it was for the students themselves to develop that social contract and develop the rules, and how important that was to your success. The second thing, good leadership with clear, consistent messaging. And it sounds like you both took the science very seriously and tried to do what's evidence-based, but you also took concerns seriously. And sometimes you did things to address concerns, even if it didn't totally jive with what was totally necessary from the science. And both are important. So this was a great session. I so appreciate your joining us, Dalia. And if you enjoyed what you heard today, please search and subscribe to the Healthy Skeptic MD wherever you listen to podcasts. Pass it along to friends, family, and others who might be interested, and leave a review if you have a chance. We'll pick it up again next week. Thanks for joining.